Hi, I'm Travis with Student Loan Planner. I want to talk about the Mission Health merger with Hospital Corporation of America, HCA, a for-profit hospital chain, and how it's eliminating public service loan forgiveness for hundreds of employees. What's happening is, in the transition from a not-for-profit to a for-profit, the employees that had maybe 3, 4, 5, 6, or 7 years of credit towards the program are no longer going to be able to receive credit towards the PSLF program because they're not going to be working for a qualifying employer. Imagine being a pediatrician with 4 years of credit only to find out that you're no longer going to be able to utilize PSLF in your loan plan. This is very frustrating, and the hospital administration and spokespersons that answered questions about the loss of this program seemed mostly dismissive. Some of the comments were along the lines of, well, this is an underfunded program, it's probably not going to happen, this is a program that we're not providing, this is something that no one should really count on. And I think that this is really interesting because I think it shows that the hospital administration really did not think about this and how it would affect employees, or maybe it was just not that big of a consideration compared to the economics of the deal. So if you are a Mission Health physician or nurse or other employee affected by this, you might need to look at moving to another healthcare system to get this important benefit, because PSLF can be worth hundreds of thousands of dollars because of the tax-free nature of the forgiveness benefit. And most people that are working there that are attendings that are already qualifying for this benefit have years worth of credit already. So I think it's frustrating that the hospital leadership really shows a lack of understanding about this program and a lack of awareness about how big the implications are to the personal finances of their employees. Because they did at least discuss that they're looking into ways to see if they can make some sort of benefit for people that might have lost this, but there's no way that they can really pay enough money to make up for this benefit. So it's going to be real interesting to see if we see Mission Health employees start quitting in a big way to take advantage of PSLF. I think only when we start seeing real labor force decisions being made about this program will hospital administrators actually respect the program and think twice before they merge with a for-profit hospital corporation. I also think in general for the hospital labor market that we're going to see, as more and more people get PSLF starting in 2020 when the first big wave happens, I think you're going to see physicians start making their employment decisions based off of this, where not-for-profit hospitals are far advantaged over for-profit hospital systems, and then I think you're going to see for-profit hospital systems get forced into offering some form of generous loan forgiveness just to stay competitive. So it's real interesting to see what's going on with this Mission Health merger. Hopefully we'll have not a ton of these in the future, because it's going to create a lot of headaches for the employees that are going for this benefit. If you are one of these people that's affected, or you're worried about how your student loans are getting paid off, feel free to send me an email at travis@studentloanplanner.com. I'd be happy to give you information on how we might be able to help. Thanks.